Hi, I'm John Hunter. I'm a psychiatrist at Mount Sinai Hospital where I do consultation liaison psychiatry.
And I'm Bob Maunder. I'm a psychiatrist as well. Our research is on the link between close relationships and health.
Our sense is that when we see patients, knowing their attachment style is very helpful in understanding their reaction to the illness they have and the treatment they're receiving and the struggles they have with that.
But if you're going to understand that, you're going to have to know a little bit about what the heck attachment is. So the purpose of this chalkboard talk is to introduce the principles of adult attachment.
And what we think is if you get a handle on that, we'll be able to add to that over time with some more installments that develop the idea further. When we talk about patterns of attachment, we're talking about individual differences and how people manage close relationships in order to feel secure. Attachment is all about relationships, particularly close relationship of the sort that are typified by a committed romantic partnership.
The thing to emphasize in understanding attachment relationships is that each of us has found ways to use our relationships in order to maximize feelings of security. So one way to understand how we differ in our attachment patterns is to start to look at the sorts of things that make us feel insecure.
One thing that makes many people feel insecure is being alone, especially at times when we are experiencing some sort of threat or stress. This is particularly true for people who are prone to fear separation and to depend on others for comfort.
Paradoxically, the other important thing that makes people feel insecure is being too emotionally close to others. This is especially true for people who value their independence highly and are mistrustful or uncomfortable with too much intimacy.
It turns out that these sources of insecure feelings can be measured, and so we can identify and label two dimensions of attachment insecurity. The dimension that corresponds to preferring not to be alone at times of stress or threat is called attachment anxiety. The dimension that corresponds to feeling more secure when keeping a comfortable emotional distance from others is called attachment avoidance.
Each of us has a kind of comfort zone when it comes to attachment relationships. Most of us experience some degree of attachment anxiety and attachment avoidance. So we can characterize how we differ from each other in this respect by the degree to which we experience each of these two dimensions of attachment. If we think about these two dimensions of attachment describing a kind of space, we can locate the most common attachment styles within this space.
Down in the corner where both kinds of attachment and security are fairly low, we find people who find it easy to feel secure. Out at the other extreme corner, we find people who find it very easy in many circumstances to feel insecure.
People who tend to experience relatively little attachment anxiety and attachment avoidance are lucky. They tend to have close relationships in which each partner values and respects their connection and can be responsive to the other. They are flexible enough to get along independently or to depend on their partner as the situation demands. They feel sad and scared in situations where those emotions make sense and feel comfortable expressing those feelings. They have an attachment style that is called secure.
People who experience more attachment anxiety will find that they feel most secure when they are close, emotionally and maybe even physically, to their partner. They're not so happy being alone. They express feelings like sadness and fear very easily, and others tend to find them too dependent or clingy, which adds to their fear of rejection and separation. They have a style that we like to call support-seeking, but psychologists typically call it preoccupied.
People who avoid attachment feel most secure when they can keep their distance and deal with threats or stresses independently. They tend to keep their feelings to themselves. In fact, if you ask a person with this style how they're feeling, they're likely to tell you they are fine. It may be hard to tell if they're bothered by stresses or threats, but their partners are likely to complain that they are too distant or unwilling to commit. They have a style that we call self-reliant, although its technical name is dismissing because they dismiss the importance of close attachments.
The most unhappy position in this scheme of understanding attachment patterns describes people who are both afraid of being alone and very reluctant to approach others or ask for help. They are caught between the push and the pull of these conflicting feelings. They experience painful emotions very easily and tend to suffer in silence. Or they may express their feelings in a way that pushes others away. Bob has drawn the stick figure for this pattern as being alone to emphasize this difficulty, but of course many people with this style have partners. It is just that their partners are challenged to find ways to respond to the contradictory message, "I am suffering, but leave me alone." We sometimes call this style cautious, to emphasize a person's need to be assured that a close relationship is safe and reliable before depending on it. But the more common name is fearful, emphasizing the more extreme feelings of insecurity that go with this pattern.
And those are the basic patterns of adult attachment that will guide us through understanding how close relationships affect our health. Since these patterns can be studied in different ways, in coming chalkboard talks we will sometimes refer to the 4 patterns, which are secure, support-seeking or preoccupied, self-reliant or dismissing, and cautious or fearful. At other times, we will refer to the dimensions of insecurity that define these patterns: attachment anxiety, which we can think of in a very simplified way as a fear of being alone, and attachment avoidance, which we can think of as the fear of being too close. These are just 2 different ways of describing the same thing: the ways in which we manage our closest relationships in order to feel as secure as possible, as often as possible.
So stay tuned for more chalkboard talks describing the many ways in which patterns of adult attachment affect our health. And if you are in the vicinity of Mount Sinai Hospital in Toronto, keep an eye out for the Men in Plaid.
That's us,
John Hunter
and Bob Maunder.